What do you say to people about masks when there's been such a strange discord about it in different counties and, even among you, some are wearing them, some are not.
Sure.
What would you say to Utahns about mask wearing over the next while?
Yeah, I would say the same thing I've been saying for the last year, and that is that, well, again, this virus has changed. I already mentioned that, and that exponential change is hard for people to understand. What we do know for sure, and there is now broad agreement, is that against Omicron, and it's so hard to change our mindset from previous variants. It's not that we changed; it's that the virus changed. So what we know is that cloth masks do not work at all. I saw one national expert who said they're window dressing. So a cloth mask doesn't do anything. Most experts now are looking at the disposable surgical masks, saying we're against Omicron. They probably don't work as well as they did against past variants for the reasons I already mentioned. So again, we're shedding millions more higher viral load than we were before. What masks do is they limit the distance at which our aerosols and our breath really spreads, right? And we're shedding those viruses, so we're trying to limit the amount of that. But when you have millions times and it stays in the air, a new study just said for approximately 20 minutes, that's out there, even with a mask. And so surgical masks, as unfortunately we're seeing with our healthcare workers who are very good at wearing surgical masks all day and are still getting infected, probably aren't as effective either. That's why the recommendation right now is for N95 masks. And even before public health officials were recommending N95 masks, I believe that they are the only way to help limit spread, especially with Omicron. And even then, it depends on how you wear them. So this idea that we wear masks and we go into a restaurant and then we take our masks off and we eat and drink and somehow the virus knows not to infect us during those times, that's not a thing. Every time you're in a room and you see somebody kind of pull down their mask to kind of catch their breath, now we have viral spread, and again, the most contagious virus that we've seen in our lifetimes. And so, what I would say is, again, we all have to make these calculations. If you are vaxxed and you are boosted and you are a healthy person, you make a decision based on that information. If you are at risk, or you are around people that are at risk, and by the way, the most at-risk people right now are those who are not vaccinated, then an N95 mask could make a significant difference and really help you. And so that's my message. I know it's confusing when we hear, well, the things keep changing, and they're right. The virus keeps changing, and that's hard for us to keep up with. But that's what we know, that these work. They don't have as much effectiveness against as they did against prior variants, but they might do something. Other questions? Okay.